Good morning, everyone. I'm Dr. Velasquez, Health Officer for Spokane County. Thank you for joining us today. And today I have a special guest who's Dr. Andre Ritter, who's the Dean of the University of Washington School of Dentistry, who's spending a little bit of time in Spokane, and we're going to tell you why. So thank you for joining us today.
Of course, my pleasure.
We are happy to have you here. And people are wondering, okay, so the Dean of the School of Dentistry, in Spokane. Okay, that sounds interesting. Why are we talking about that? So let me tee up a question, because one of my concerns is, as a general rule, most people don't think about oral health or dental health as an important component of overall health and public health. So if I were to ask you, why should we think about it within the context of total health as well as public health?
Thank you, and good morning, Dr. Velasquez. Thank you again for having me here. That's such an important question. Often, dentistry is seen as a little bit of an isolated profession in the context of overall health and public health more globally. But more and more, we recognize through research and clinical observations that oral health is completely integral to overall health. There's research showing that periodontal disease, for example, is linked to heart problems. It's also correlated with oral and head and neck cancer, preterm births. So there's a lot of implications around overall health if you don't have good oral health. And part of my mission, if you will, here in Spokane for this extended period of time is just to raise awareness about dental health and how important it is for people to maintain overall health. There's also economic impact for from oral diseases. Children miss school, not just children, but adults if they're studying, they miss school if they have oral diseases and dental problems. There's huge impact on the economy as well with hours of jobs and people not being able to feel comfortable about themselves relative to interviewing for jobs, for example. You know, well-being. I think those of us who have ever had dental issues can relate to what I'm talking about. So I think that's how I would frame that question. There's absolutely no question in my mind that raising awareness about the how oral health is integral to overall health is something we should really talk about more often.
Well, I appreciate you giving us so many examples, because that really makes the point that that has an impact on the whole community at all levels. You mentioned multiple age groups, multiple areas of endeavor, multiple issues. So we do have to start thinking about it from a community perspective, that this is an important aspect of the health of our community, not just the individual health, but also the health of the community. Shout out to my primary care provider, who always asks me about my oral health. So
good job.
That's
Yes,
important. Yeah,
absolutely.
she believes that that's part of my overall health, and I think she's absolutely right. But so I'm fortunate that I have that kind of provider. I do know that not everybody does. From your perspective, based on your experience, what are common barriers that people find to getting that kind of oral health support that they need?
Yeah, the number one barrier is the awareness that we just talked about, but I think also very importantly is just access from a regional standpoint.
Okay.
I think those of us who live in cities that are of mid to large sizes like Seattle, like Spokane, there are dental offices just down the block. We have easy access to dental office. There are economical barriers that might make it hard for people to access those services, so that is one point as well. But one of the goals for the University of Washington School of Dentistry is to really address issues of access to care in rural and underserved areas. This is not just a problem in the state of Washington, it's a national problem. And I would say it's a global problem, because in interactions with deans of other dental schools across the world, actually, the regional aspect of access to oral health is a huge barrier everywhere I go. So again, in cities and metropolitan areas that have good numbers of dentists, the barrier perhaps is more economic in nature.
Okay.
But beyond that, what we're trying to address with our program in the University of Washington School of Dentistry is access to care from a regional standpoint. Just to give you an example, in King County, for example, here in the state of Washington, there's one dentist per 1,000 people.
Okay.
So that's a pretty good metric of density.
Okay.
There are counties in the state of Washington that have one dentist per 12,000 people, or even less in terms of that ratio. So that is a significant barrier that we have to be intentional about addressing.
And I know that education and having access to dental education is one of the goals of us as a state to have generate more of our own dentists. I know that one of the reasons why you're in Spokane, in addition that you like being here,
Absolutely.
thank you for
Yeah,
coming,
yeah.
is you've been working on what is called the Regional Initiatives in Dental Education, or RIDE for short, R-I-D-E.
That's right.
Can you tell us a little bit about that?
Absolutely. So that is I'm so glad you asked me that question. And I do love Spokane, by the way. We love being here. The Regional Initiatives in Dental Education is a program that started at the University of Washington in 2008.
Okay.
Since 2008, we've had a cohort of dental students here in Spokane that are spending a significant amount of time in their dental school training in the community. And in addition to that, they also spend a significant amount of time when they are in the fourth year of dental school treating patients in community health centers across eastern and central Washington. So this program started in 2008. Dental school is 4 years. When the program started, we had students spend the first year in Spokane,
Okay.
and then in the fourth year of their training, they spend 5 to 6 months doing a clinical rotation.
Okay.
Just 2 years ago, we were able to expand this program, where now we have more students. We double the number of dental students that are in Spokane. We also expanded the curriculum from 1 to 2 years. And we kept that fourth year rotation and are expanding the number of sites. So this is incredibly impactful, because since the program started in 2008, about 80% of our dental students who train in that program, they go back to rural and underserved communities and set up practices or participate in dental care in community health centers right there in those communities. Many times the students come from those areas.
Right.
We have a very intentional recruitment process that is focused on attracting dental students that are interested in this particular program. So this expansion, just to give you a sense of the impact, when the program started, we had 8 dental students in Spokane at any given time. Right now, with the first and second year, we have 32 students.
Wow.
So it's a significant increase in the number of students that we're training. And that means if we can maintain that return to the rural and underserved areas, it's going to be a very substantial impact in the ability of patients and families that lives in communities that normally wouldn't have access to dental care will now have more dentists working in those communities. So it is really an innovative program in dental education. There are other dental schools that have intention to address this area, but there is really no program in the country quite like our RIDE program. So we're very, very proud of that program. Obviously, there's a lot of effort behind, training faculty and staff, and our students are really excited about participating in that program. And one of the reasons I'm here in Spokane for the entire month of April is really, number one, to raise awareness about oral health, and also to support this program. So I've been teaching our students, I've been meeting with community leaders like yourself, and making sure that people know a little bit more about our RIDE program. And it's really been a wonderful opportunity to talk about this program, around Spokane and the region.
Well, and I appreciate you coming. I'll tell you a secret. That's the reason why I wanted you to come, because I know a little bit about what the program is doing, and I said, people need to hear about this, because this is actually a great effort, and addresses one of the barriers that you mentioned in rural areas, which is not having enough professionals. And obviously, as we graduate all the students, if they're able to stay in the region, that increases the number of providers, which hopefully will go a long way in addressing some of those barriers. So best of luck on that one. And let's keep those students going into all of these areas that really can use their services. And I have to tell you, I did rural health when I was in medical school, and you become part of the community,
Absolutely.
basically as a student, which is a great experience for anyone going through that education. So people in the community are probably saying, well, that's great. And that's the University of Washington. And I know you have partnerships with various of our other academic institutions, which we'll talk about in a second. But how can the average citizen be supportive or help? And how can they find a way to really help support these programs?
Absolutely. So the number one way that communities can help is really to participate and go to the clinics where our students are training. I would just take it a step further and say, go to your dentist twice a year as the recommendation from a public health standpoint.
I do.
Absolutely, yeah. And but if you are living in an area where a community health center clinic has a dental program, and many of them do, and if part of that program is there's a dental student there participating in a clinical rotation, take the opportunity to interact with that student, to really place yourself in a position where that student can help you and have a conversation with you. I think that's one way to support the program. I also would like to do a shout out to the dental community. As the program expands and we continue to establish more partnerships with clinical sites across Eastern and Central Washington, we will continue to rely on the support from the dental community, from the dentists, the dental hygienists, and the profession in general, because we are going to need to have more preceptors, colleagues that are able to supervise our dental students when they are out doing clinical work in the field. They're students, they're not licensed, so they have to work under the supervision of a licensed dentist. And since the program started, we have been able to activate a very robust network of friends and colleagues who are supporting the program. With the expansion now, we need to continue to expand that network so that this expanded format of the program is sustainable. So that's the number one goal for us, is to ensure that there's sustainability of this program over time.
Wonderful. I'm glad you mentioned the presence in the community and the dental practices, and shout out to our dental professionals for their support. We appreciate that. But I'm glad you said specifically, if you see the students, interact with them, because as I go around healthcare and all the facilities, they all have their badges as students, so it's very easy to identify. And I think it's good to engage them in conversation and see who they are, where they're going, what their thoughts are, and make them feel welcome in the community. And I know that our preceptors and professionals try to make them feel like colleagues. Although, we know they're students, but someday they will be our colleague when they finish. So I do want to say thank you to everybody that participates, not only in the formal dental school program, but also in the communities where the students are deployed. Any last thoughts for our audience before we let you go back to work? Because I know you have a busy schedule.
Absolutely. No, happy to spend time here. And I think it's important to also recognize the partnership that you alluded to earlier. So our program is a partnership. Our regional initiatives in dental education, RIDE program, is a partnership between the University of Washington and Eastern Washington University. Our program is also located at the Health Peninsula here in Spokane. And as such, we are in the UW-Madison Gonzaga University Health Partnership. So it is, again, as you mentioned earlier, not only an important initiative from the School of Dentistry, but it's really an initiative that engages the community, the profession, health care in general, as well as multiple higher education institutions in the region. In my time here, I have been able to not only speak about the relevance and the importance of the program, the educational program, but there are certainly public health partnership opportunities as well as research opportunities that can continue to advance dentistry in the context of health professions. There's also something to be said about integrating a little better dentistry with medicine, with nursing, with other health professions, and that's how we started this conversation. So I think this will be a good way to sort of bring it all together. And in closing, thank you so much for the opportunity to speak about dentistry, oral health, our RIDE program. Congratulations on your work here, and I look forward to a conversation in the future.
Well, thank you. Appreciate you coming. And folks, I want to highlight the level of collaboration that our academic institutions are showing here, because at the end of the day, we as a region need all levels of providers. And the better integrated our programs are, the more collaboration there is, the more collegiality there is, and there is a lot, because I spend time with the students, and it doesn't matter which program they're going to, all the students are always excited to be in Spokane. We do a great job of welcoming them here, so let's keep doing that.
Absolutely.
But I do want to say thank you, because it's an important aspect that, as I mentioned at the beginning, sometimes we don't think about as much. And oral health and dental health is extremely important for your, not only your physical health, but your mental behavioral health, your social interactions and job interviews and everything else that can impact the life and the economy of the community. So with that, thank you again for everything you're doing. You're always welcome to come back if you have additional information. And we want to say thank you to everybody for joining us today. We'll see you again next week. Have a great day. Stay safe, stay well, and thank you.